So as you can see, the recording of our meeting has started. My name is Zeynep Gurtin. I am the Programme Director for the MSc in Women's Health, which is obviously the master's programme that you guys are all interested in. So I'm going to be telling you a little bit about our master's programme and studying at UCL in general. Hopefully that's going to give you a kind of a nice introduction to what you might expect. So firstly, to say, after a couple of years of COVID, we at UCL are now fully back to face-to-face teaching. So that's what you can expect, in-person teaching, and our campus is now completely open. We're really looking forward to all our students being in London, and that's the case that we're working with this year. There are lots of initiatives, both at our institute and at UCL, to make sure that students feel a strong sense of belonging while they're at UCL, and that they feel not only a part of this master's cohort, but also a part of this university, which we are obviously very proud of. So why would you come to UCL? And I think, I hope everybody has got quite a few strong reasons of their own. But in terms of, I think some of the things that are very important to me at UCL, UCL was founded in 1826 on the belief that education should be available to all who could benefit from it. And I think while a lot of us feel that that's a kind of a very accepted idea nowadays, it was obviously very radical and pretty much unheard of in 1826. So it's got this very noble roots. It was the first university in England to accept women on equal terms with men, and also the first one in England to disregard social and religious backgrounds. So it's a university that has a really proud history. And one of the things we do at UCL is we operate something called a connected curriculum, which means that we try to make links between research and teaching so that the students are receiving teaching from world-class researchers in the specific areas that they are experts in. So as many of you know, I guess UCL is one of the best universities in the world. And recently it sort of jumped right up to be number 8 in the world. So, it's obviously the top one in London, and it's a really, in a global sense, it's a very elite university. Suzy, I think you can probably see we've got somebody in the waiting room. If you could let her in for me, please. In terms of the academic excellence at UCL, we have more than 13,000 staff and 42,000 students from 150 different countries. So for me, teaching here at UCL, that's one of the most wonderful things, is the variety of cultures and backgrounds and the diversity that we have within this university. UCL operates in a global context, and it is committed to excellence, innovation, and the promotion of global understanding in all its activities, whether that be in research or teaching or learning or enterprise or community engagement. So you can see here a few details of what we mean by UCL being a global university. We have an alumni of over 250,000 members in 190 countries worldwide. So it's a great place to meet colleagues and peers from all across the world and to really make connections that will last you for a lifetime. So just like any main university, you've probably noticed that UCL is a very big organization. And I think that can be quite hard to get to grips with, the sort of the structure of a university at first. The easiest way to think about it is you have the university, and then the university is broken into 4 major schools. So the school that we are under is the School of Life and Medical Sciences, SLMS for short. And within the School of Life and Medical Sciences, which is huge in itself, there are 4 large faculties. So one of those faculties is the Faculty of Population and Health Sciences. So you have the university, you have the schools, you have the faculties, and then under the faculties is where our Institute for Women's Health sits. Now, the Institute for Women's Health is a really varied and diverse and interesting institute to be studying in or to be working in. We have people from a huge range of backgrounds, including clinical medicine and hard science, but also increasingly from a more sort of epidemiological or social science or global health perspective as well. So within the Institute for Women's Health, we have 4 major research departments, and I hope you can see that on the slide there. It's neonatology, women's cancer, maternal and fetal medicine, and reproductive health. And each of those 4 major research clusters or research areas will have a range of staff members and research activities going on within it. So I'm actually part of the reproductive health group, the orange one. And within that reproductive health group, you can see there are several different research clusters listed. So I am part of the reproductive science and society group, which is probably the most social science oriented group within the department. And we really look at how reproductive science interacts with society. So, you know, things like my own research looks at why are women interested in freezing their eggs and how do they feel about doing that? We have colleagues working on donor conception, fertility education, etc. So really that interface of reproductive science and society. But there are other departments and other researchers who might be working on something much more sort of hard science or lab-based, including, you know, gene transfer technology, etc. So the motto for Institute for Women's Health is to seek for better lives for women and children across the world. And if you'd like to find out a little bit more about what the Institute stands for and what it does, you can see this sort of 15-year celebratory report that was published in 2019, and I'd really recommend just having a quick look at that to get to grips with the kinds of research that takes place at the Institute, etc. So in terms of specifically moving on to education, we have 3 master's programs and an IBSc program, which is for medics who are sort of taking a specialist year. And several other possibilities. But in terms of the master's program, the Women's Health Masters that you are all interested in is the youngest, the newest. It started in September 2018. But, you know, while this is quite a new master's program, it sits within an institute that has a huge amount of experience delivering master's programs, which started here in 1996. So I think, obviously I'm biased, but I do think the MSc Women's Health is a really special and exciting master's because it has that sort of unique ability of combining clinical insights, scientific insights with social, political and legal perspectives as well. So it gives you a really rounded understanding of women's health. And we have students that come from lots of different backgrounds, including midwives or nurses or doctors, but also students who've studied social sciences or psychology or epidemiology, and who think about, you know, whether in the future they're thinking about going into medicine or whether they're thinking about going into policy and NGO work, or whether they're not quite sure what they're going to do. But so we have a really exciting mix of students interested in these different questions. So the structure of the MSc program is that at the very beginning in September, when you start, there is an introduction and induction week where we sort of talk you through and introduce you to everything from the university to the faculty to your cohort. And then the second week is a project or skills week where we explain how we approach research methods, research skills, and just do some really kind of forward thinking about how the projects are going to work. Because for a lot of people, the project is obviously a very large part of their degree. Following that, everybody will take 8 taught modules. 4 of those are core modules. I'll talk a little bit more about those with the next slide. And those core modules are exactly the same for everybody on the course. Everybody will take the 4 core modules. But on top of that, you will each have the opportunity to choose 4 optional modules. And you have a pretty broad choice about which optional modules you choose. And that allows you to really cater this master's to your specific interests. So whether that's mental health or global health or child health or aging, you can pick the core and optional modules to suit your interests. So those are the first 2 terms. And then in the 3rd term, starting at the end of the 3rd term, starting in June, you will begin working full-time on your research project. And that tends to take you all the way to September when you submit. And I'll talk a little bit more about the research project in a moment as well. And there's obviously integrated throughout the year various career sessions. Now, students can choose to do this MSc Women's Health either full-time in 1 year, so doing all 8 taught modules and their project in 1 year. They can do it part-time over 2 years, or you can actually do it modular flexible, which allows you up to 5 years, you know, if you're trying to fit it in amidst your work, etc. So the core modules, the 4 core modules we have on the MSc Women's Health in the order in which they appear on your course are Understanding Research in Women's Health, which aims to equip students with the skills and knowledge necessary to make sense of women's healthcare research and innovations in practice. So you really get a sense of how to read research and how to distinguish between robust, rigorous research and maybe less good research, and how to use research to inform opinions. Then female reproductive anatomy, physiology and pathology, which aims to provide knowledge into all aspects of female anatomy, physiology and pathology during a life course of a woman from puberty to menopause. And I would say that for the social scientists among you, that is the most sort of science-y core module, but actually a lot of people find it's incredibly useful to have that basis in order to fully partake in discussions around women's health. The next one is Concepts and Controversies in Women's Health, and that's one of my modules. And here the aim is to introduce key concepts in women's health. So things like medicalization or inequality or intersectionality, and to use these to discuss controversies in both the UK and globally, and to address social and ethical issues. So we might be looking at controversies around ethnicity and maternal mortality. We might be looking at things like female genital mutilation. We might be looking at gender identity issues. So it's really to unpack the various controversies in women's health. And then the final module, which I also co-lead on, is called The Legal and Ethical Aspects for Women's Health. And this aims to introduce the legal, ethical, and moral issues affecting women's health and well-being. And there we really go through in quite a nitty-gritty way the key pieces of legislation that impact women's health and medicine in the UK. In terms of the optional modules, there are a range of optional modules, both within the Institute, so modules offered by colleagues within Institute for Women's Health, and also from UCL more widely, which we felt would be potentially of interest to students. So this is going to allow you to shape your own learning and to tailor it specifically to your interests. Obviously, it does need to kind of fit in with the timetabling, etc. But we're usually able to accommodate, you know, the different choices that people want to make. So, and I can guide you on how that works if you're interested to find out more. All of the modules have assessments, but the assessments for different modules will be different. So sometimes it will be a critical review, or sometimes it might be an online exam, even a multiple choice exam. Oftentimes it might be a 3,000-word essay. So it just, you know, it might be a case study, a book review, a presentation. So all of those assessments will be tailored to the subject of the module. So you may remember I mentioned one of the modules being particularly scientific, where you're learning facts and information. So that's an exam that's multiple choice. For example, where we're discussing concepts and controversies, it's an essay where we expect you to discuss those issues. In terms of the timetabling, each of the core modules that we have, which are in they're in bold in purple here. So Understanding Research in Women's Health and Female Reproductive Anatomy, Physiology and Pathology in Term 1, Concepts and Controversies and Legal and Ethical in Term 2. Those are what are called short, fat modules, which I still find these terms quite funny. So these are 3-week modules, and within those 3 weeks, you will have 2, 3, or 4 days of face-to-face full days of teaching. Some of these other modules, so again, the light purple ones are offered by our department. Those also tend to be short, fat modules. But some of the modules from other departments, for example, health-related behaviors and conditions, or gender and global health, they might be what are called long, thin modules, so that the module runs for the entire term, but you only meet one afternoon a week, for example. So it's just a case of trying to fit all of that into your timetable and into your workload. So the project, which everybody starts doing in June, there is a lot of flexibility in terms of what students might want to do for their projects. And really, all of our staff, this is part of the, the connected curriculum idea at UCL. All of our staff at the Institute for Women's Health will be offering projects for students based on their expertise and their interests. And students can sign up to work with different supervisors, and they can do projects that might be a lab project, or it might be a narrative review, or it might be data collection using surveys or interviews. So it really depends on what skills you want to learn, and maybe what supervisor you want to work with will depend on what kind of project you end up doing. So for example, this year I have 4 project students. One of them is doing a literature review of older motherhood. One of them is doing an analysis of fertility clinic websites to see representations of ethnic diversity. One of them is looking at issues related to perinatal mental health and older motherhood. And one of them will be looking at Black women's experiences going through IVF. So it really, there is a huge variety, and I have colleagues who are offering lab projects, colleagues who have large long-term data that students can analyze as part of a project. So lots of variability there. Some of the past examples here you can read: midwives' knowledge and attitudes to consent law, marketing of egg freezing. This was one of my past students. How do UK fertility clinics present and advertise their elective egg freezing services? Analysis of the curriculum for nurses, midwives, health visitors, etc. So you can see a big range of different projects. So as I already mentioned, our students come from lots of different backgrounds. And just in the last 2 years, we've had students from human development, nursing, medicine, midwifery, psychology, biology, nutritional science, neuroscience, homeopathy, international relations, public health, sociology, history. So really big range, and lots of different personal circumstances, which might mean that it's most appropriate for them to do full-time, part-time, etc., and from all over the globe. So over 20 countries in 2019, 2020. And in terms of the kind of careers people might go on to do, there's obviously a huge range, and you'll get a lot of help with that through the UCL Careers Service if that is something you're interested in. Some people know exactly what they're doing, and they're just taking a year out to do their masters, and they're going back into their midwifery or whatever. But for other people who are unsure about where they might want to go after their degree, UCL Career Service really offers lots of, very helpful advice and scoping and things like that. And those are just some of the possibilities. Once you've accepted your offer from July, we'll give you access to our welcome Moodle page. And the Moodle pages are really the online hub, the virtual learning platform that UCL uses. So all of the information you need for your upcoming courses will be on Moodle, and you'll also be able to interact with us through there, send us messages, etc. For those students who are going to come on the course, we can send you some pre-reading over the summer, which will really introduce the core topics, particularly for the core courses. And then once you're at UCL, there's obviously a huge sort of network of student support and feedback. And you will hear a little bit from current students in a moment. So this might be somewhere where they can talk a little bit more about really the web of support at UCL. We really try to ensure you are as well looked after as possible once you're here. So to find out more, you can go to our website and specifically look at the postgraduate taught degrees for the MSc Women's Health. You can follow us on Twitter. I have my individual Twitter account, and the Institute has a Twitter account. So you could follow all of those. And yes, do please feel free to get in touch, drop an email if you have any questions. And obviously, we're more than happy to answer your questions now. I'll have a little break now if you would like to ask any questions now, and then we will hear from some of our students. But I'll stop here and just see if you guys have any thoughts or questions or feedback. No, you're all good. Shall we carry on? Francesca and Deborah, would you guys like to put on your videos and maybe introduce yourselves and say a little bit about your experiences of both UCL and the course? Deborah, maybe you could start.
Yeah, of course. Hi everyone, I'm Deborah. So my background is in adult nursing. So my BSc is in nursing. And then whilst going into nursing, because I work in gynecology, I said I wanted to learn more. And UCL kind of fulfilled those needs plus more. So I found that the women's health course taught me a lot about the psychology, the sociology, the biology of women's health. And therefore it allowed me to relate to kind of things that I go through as a woman in society today as well. So yeah, not only educationally did the women's health faculty kind of help, it was also pastorally. So obviously working as a nurse now, go through a lot of stresses. So my personal tutor was amazing, as well as the director, really helpful in checking in. And we get these weekly meetings where we can kind of divulge and express everything that we're going through with the course and kind of emotionally and with our own lives. And yeah, it's just been amazing, an amazing experience. I'm still got another couple months left, but yeah, I've had a great time with the women's health course. And
yeah, and you're doing part-time, aren't you,
yes,
Deborah, while still working on the side? Has that been difficult to negotiate?
At times my job's actually really understanding. So my because my manager is very she's a strong advocate in women's health in the background. So she was very much happy with me. She was like, yes, if I could pay for it, I would. So the only thing they could offer me was time at work. So they've been very accommodating. There was an agreement kind of to allow me uni days off. And then when I'm not in uni, I'll go to work. So work have been really accommodating. And then on the UCL side, kind of when I've been finding it a bit too stressful, I've been going to my personal tutor or the director to say, okay, this is what's been going on. And again, more than amazing with kind of talking me down and things, and be really reassuring, to be honest.
That's great. Thank you, Deborah. Francesca, you've started quite recently. You're a full-time student. You've started in September. Would you like to just tell us a little bit about your experiences, please?
Yeah, of course. So yeah, I'm a full-time student. I started this year. I actually just finished my undergraduate as well. And I did an undergraduate in psychology. So more from the social sciences side of things. And I wasn't sure about where I wanted to do, where I wanted to go, but I found this master's on the UCL website, and I gravitated towards it because it really just spoke to my interests and my personal passions. And I was really interested in the fact that it offered this kind of biological side, medical side of the topic, but then also the social issues, which is something that I'm passionate about pursuing in a future career. So that's why I chose it. And so far, I've loved every second of it, honestly. I keep on raving about it to all my friends, and I've convinced most of my friends on other courses at UCL that they should in fact be doing this course. But it's just so interesting. And then beyond the content, the people that I've met on this course are people that come from complete different backgrounds. So it really helps in like group discussions to have all these different perspectives, and it creates a much more holistic understanding of women's health, which I think is so important. So it's been really good to kind of have those perspectives, and then also be able to kind of use that to inform my own choices in tailoring the program to make it work for me. So with the optional modules, but then also within the modules themselves, we have a lot of flexibility in essay topics, and pursuing our own passions within that. So it's, I think, a really great step for me as a first step in my career and setting me up for the future.
Great, thank you. We have not paid these guys, I promise you. It's so lovely for me to hear, you know, the passion with which both of you are speaking as well. It's such a joy to be able to teach students who are really committed to their subject. So thank you both so much for being here, and they're obviously open to questions as well. But before we go to any Q&A, I also want to introduce you guys to Owen, who's just joined us. And I mentioned the different modules. All of the modules will have module leads, usually 2 module leads, who look after that module. And Owen is responsible for the female reproductive anatomy, physiology, and pathology module. So hi, Owen, welcome, and thank you for joining us. Do you want to say a little bit about your experiences, your research, and running this module as part of the MSc, please?
Yeah, thanks, Zeynep. Hi, everyone. Sorry for being a little bit late joining, but it's nice to see you all. Yeah, so my name is Owen Vaughan. I, as Zeynep was saying, lead the reproductive anatomy and physiology module. And I also have an active research program that's really in the maternal fetal medicine department of the Institute. Our module, which I co-lead with a reproductive medicine specialist, is sort of really giving you the biological basis of reproductive anatomy and physiology across the life course in women. So we start out talking a bit about how sex is determined in the early period of life, in fetal life, how male and female fetuses are differentiated, but we also talk a bit about the concept of gender and how that's a more of a complex kind of issue, which is
very topical,
personal level. Yeah. We have a urogynecology specialist to talk a bit about the anatomy of the reproductive tract, and then we talk a lot about the physiology of reproduction, so how puberty is regulated, the role of hormones in regulating ovarian function in the situation of fertility and in infertility. So we have some expert lecturers, both from a sort of a biological and clinical side. We also have some more discussion and presentation-based sessions where the students get involved and do some work themselves. So those went really well this year. I think we had a journal club presentation and a discussion. And then the assessment for this module is based on sort of a real life application of reproductive science and women's health. So we ask you to do a press release and a patient information leaflet about some reproductive health issues. So it's a fun module, and it's a good one because it combines sort of all of the different people from the different courses in the Institute. So it's a good one for getting to know everyone.
Brilliant. Thank you so much, Owen. And last but not least, I would like to just hand over to Suzy Buckley. Suzy was actually the program director for this MSc until about 3 weeks ago when I took over from her. So Suzy is very well qualified to speak about the MSc, but maybe you'd just like to also say a little bit about your own research, Suzy, and your role as head of education.
Hi everyone. Yeah, thanks, Zeynep. Yes, so Women's Health Masters was set up in 2018, like you said, Zeynep, by myself and the rest of the team, and it's grown really from strength to strength. We started with just 9 students, and we now have more like 25, 27, I think, this year. So I am an associate professor in the reproductive health section of the Institute. I'm interested in solo motherhood and families created by donor conception in my research. I'm also the Director of Education for the Institute, so I sort of oversee with Maria Hristova the rest of our master's programs as well. So you will see me in various guises across the induction week and skills week, and probably throughout the programs as well. But yes, I've handed over my baby of the MSc Women's Health to Zeynep. She will be fantastic as a program director. But we're all still around for people to come and talk to. Everyone has different experiences and different strengths, etc. So we're all very available for students to come and talk to with any issues or problems that they have. And I'm very happy to answer any questions if they come up.
Brilliant. So that's all from us. We are really happy to answer your questions or to talk more about anything you're interested in. That goes for us, that goes for the students, or just to really hear from you guys in terms of what it was that made you interested in this course, what kind of background you come from. So we would love to hear from you if you'd like to sort of share with us.
Feel free to type things in the chat if you'd rather.
Yeah, or just unmute yourself, whichever you prefer.
Thank you so much, first of all, for the presentation and the insights. It sounds super, super cool. My background, I'm a health economist, and I'm already really engaged around women's health. Also, I did within my own master's degree already focused on women's health, contraception in particular. I'm wondering how are you interconnected with the ecosystem in London, the women's health ecosystem, the different institutes, and also if there are what is the path since it's going since 2018? What do you see? Where are the students going? And what they end up to in their career, kind of.
Yeah, I mean, Suzy and I can respond to that together. Our students end up going to lots of different places. And in terms of the different places we're plugged in, it's actually really different depending on who it is you're talking to. So as I mentioned, our institute's very varied, from clinical scientists to hard scientists to sociologists. So I am, for example, I'm a social scientist, I'm a sociologist. I have recently become convener of the British Sociological Association's Human Reproduction Study Group. So I have a lot of links in that world. And I am also an authority member of the Human Reproduction and Human Fertilization and Embryology Authority, which is the regulatory body that looks after sort of fertility treatments in the UK. So I have links, predominantly in those places. But we have, for example, you've mentioned contraception. One of our colleagues, Julia Bailey, is one of her specialist interests is in sort of contraception and sexual health, and so she will have special interests there. So it really, everybody has kind of different links with different places. In terms of my students, for example, some of them have gone on to work for the Human Fertilization and Embryology Authority. Some of them have gone back into clinical practice. Some of them have gone into NGOs like Brooks, which is a charity, a sexual health charity. I know a few people have applied to different WHO kind of groups associated with women's health and migration. Suzy, do you have off the top of your head other sort of...
I think the only thing that you have mentioned is that quite a few students have gone on to do PhDs and further research in those topics. I don't think any at the Institute as yet, but certainly in those fields. So I think that's something that students are interested in as well. And we do have, like Zeynep said, specific careers days throughout the programme, as well as being plugged into both the faculty and UCL specific careers.
Writing as well. A couple of our students have gone on to do writing-based careers, whether they're working with organisations to do their information and copywriting and things like that. Or,
I had one
very, very varied.
Yeah,
Femtech also, students who've gone into launching their own femtech companies. Mm-hmm. Sorry, Suzy, I interrupted.
Sorry, we had one student who's working for I can't remember what it's called, but the French version of Planned Parenthood. It was a French student, but yeah, so that was something that they were really interested in.
Yeah.
Amazing, thank you.
I can see a question in the chat, Zeynep, as well about...
Yes, okay, let's have a look. So Francesca says, I know a few people currently doing the course full-time who are also working part-time at retail jobs. Yeah. However, I'm not, since I'm doing research project, which requires extra time commitment. Yeah. I mean, there are a lot of students who combine a little bit of work, paid work, while they're funding their studies as well, which can be difficult, but sometimes it's necessary, which we do understand. So Natalia says, I have a question regarding the entry requirements. I can see on the website you need to have a bachelor's degree in order to apply for this course. I'm currently third-year medical student wanting to intercalate next year. Am I eligible to apply as well? I'm asking as my friend was in the same situation as me last year, and she has just finished master's degree at UCL. Now, I'm not sure about this. Most of our medical students who intercalate tend to do the IBSc. What do you think, Suzy?
I mean, sorry for interrupting, because yeah,
no,
my
please.
friend, she actually finished master degrees in anthropology like this July, and yeah, she's still a medical student, and she did intercalate, like not doing bachelor's but master's. So I was wondering if it's possible for me as well, or would you encourage me to actually do bachelor's first?
It's a little tricky. We would normally point people in the direction of the IBSc. However, if you're not currently at UCL, I know that our IBSc program is so popular with internal students that we haven't been able to take any external students on the women's health IBSc just from capacity issues. And we're currently discussing about, given that, would it be possible for us to take those students that would normally be intercalating on the MSc program? Can I ask you to email me? And then I will look into it further, because it's literally a live issue at the moment because
Okay, great.
with our capacity. Because we have had students that have done that in the past, I should say. They're normally very successful students. It normally works very well. The problem is not content. The problem are logistical issues. So, for example, in terms of timelines, we can't get your degree results to you in the right timeline that will allow you to then, before you then go on to pick your fourth and fifth year options. So that's always a logistical problem. And also you have to sort of sign out of one program to then come into our program. So it's these annoying paperwork things, but unfortunately some of those are just outside of our control. So if you email me, I will push our faculty people and see how, if we can make any progress on that.
Okay, thank you so
Suzy,
much.
would you mind just putting your email in the chat so Natalia's got it ready?
Yes, that would be helpful. Thank you.
You very much. Isabel, I know you had the question about part-time work. Was there anything else that we might enlighten you about that you might be interested in?
Well, thanks for asking. I think I have no further questions. I would like to do the postgraduate certificate, so not the full master's. So yeah, my biggest question was if I would be able to do the courses. I would like to, but you already mentioned before that most students get to follow the courses they would prefer. So yeah, I think it's all good. Yeah.
Isabel, have you already applied, can I ask?
Yes, I have.
So it's interesting. We very, very, very rarely get students applying for the PG DIP and the PG cert. And actually, we were considering removing them, but I've looked at your application and it's very good. So I think we may remove them in the future.
Just keep it for you.
Keep it on for you.
I'm very glad it's still here now for me.
Masito, I don't know if I'm pronouncing your name correctly. I'm apologizing if I'm not. I know you joined us a little bit late. You will be able to view the recording of this, but while we are here, if you want to write anything in the chat or unmute and ask a question, very happy to answer any questions you might have.
I wondered as well, Zeynep, while people are thinking of other questions, well, quite a good question that we've had in the past is for the students, and it's basically to say, what do you wish that you'd known before you started? Now that you've done some of the program, especially Deborah, who's done sort of a year of it, what do you wish that you'd known at the beginning that you didn't, so you could pass on your wisdom to the prospective students we have here? Deborah, would you like to start, if you can think of something?
I can't really think of anything right now, just because the actual UCL website is so informative. Even now, sometimes I see myself going back to the actual original website just to look at the modules and things. So I personally don't see that there's anything. I think everything's really informative and laid out kind of in lay terms. So I don't really have anything to say.
I think it's nice because, like you said, you were talking about working at the same time. I know, you know, Zeynep's laid out how the modules are organised. In general, we should be really clear that the timetables for each modules are different, and they're often not, the precise timetables are often not available until a few weeks before the modules start, which is unfortunate, but just because we have so many external lecturers, so we invite clinicians, you know, who are experts in the topic, for example, or other people from outside of UCL, it's very difficult to have a lot of notice about timetables. So working alongside it can be really challenging. And we do have an institute policy of no teaching on Wednesdays, so that we organise our observation days within that time. And so sometimes that works for students to do shifts on Wednesdays, but just it's something to be really mindful of. I know Zeynep will be happy to have conversations with people about whether they'll be best going for part-time or modular flexible, if that's something that they'll need to do. Because we understand, you know, fees are expensive and London is expensive and cost of living is expensive. So we really understand that working is often necessary. But we really just want you to make sure that you have the best opportunities to spend time on the programme. I mean, a full-time programme is a full-time job. It is a lot of work. I think the students would agree. I can see them nodding. So I think that's something to be really clear about. Sorry, Deborah, I interrupted you.
Yeah. No, I was basically going to agree with you. I think the only thing that I remember in the beginning when I had submitted my application, and I think, Suzy, you noticed I was a nurse, and you were like, listen, it's a full-time course. Have a think about it first. And that's when I moved to modular and then moved back to part-time. But I think it was really important for me to kind of know that when you're doing the full-time course, there is very little time to concentrate on other things work-wise. So hence that's why I personally moved back onto part-time, because it was difficult to juggle full-time work plus full-time course. So yeah, that was really important for me to kind of know.
That's good. Francesca?
For me, honestly, I think that although it's outlined, I didn't realize how much support was actually available at UCL and how engaged and available the lecturers are as well to answer questions and to discuss topics further. So a lot of the lecturers have been free to meet after class hours to further discuss things that I've found interesting or questions that I've had. So it's been really helpful on that end with the lectures, but then also from a personal support kind of side, we've got the personal tutors, and that framework is a lot stronger than my previous university. So it's been really good to have that personal support. And then also the director of the module support, that's been invaluable, especially the skills week. I didn't realize how useful that was at the beginning of the year, just to kind of really feel engaged and integrated into the UCL community, understand all the different like online Moodle pages and everything, which was confusing at the start, can be still confusing now, but a lot more understandable after that skills week. So it was really useful to have that to kind of kick off the year.
Great.
Thanks, Francesca. Yeah, I think one of our things that we're constantly saying to students is, you know, life happens, things happen during a program. Of course they do. They happen to everybody, staff as well, you know, and really the important thing is that students talk to us, that they communicate well, that they, you know, preempt when they might be having a problem. There are lots of support things at UCL. There are lots of things that we can help with. There are lots of mechanisms we can help, we can put in place to support you. But it's really just important that you come and see us and talk to us about that as soon as possible.
Yeah. Great. Well, thank you guys all so much for making the time to come along today. It'll be lovely if we actually get to see you here at UCL come September. And if you do intend to come, obviously, we will be in touch before then. You'll be able to see lots of details on the Moodle page, but you can also email me or email Suzy. Yeah, it's lovely to meet you. Have a lovely rest of your day.
Bye everyone.
Bye, everyone. Bye-bye.
Thank you. Bye.
Thank you. Bye.